You are listening to a recording from the 2021 PM&R Scholars Virtual Residency Fair. We would like to take a moment to thank the residency programs who have taken the time to present at our fair this year. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap, the best resource for your physiatry clinical preparation, audition rotations, board preparation, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and even oral board cases. Head to pmnrrecap.com to learn more.
All right, so my name's Nate Dusto. I got with me Valerie Chavez-Aram. We're the two chief residents for UC Irvine, and I'm happy to give you this presentation to kind of show you a little bit more about what we have to offer you guys. So just a quick overview. These are some of our residents. We haven't had our picture day yet, so I couldn't upload it with the update it with the newest residents here, but we take 5 residents per class for a total of 15. All of our positions are advanced. There is a prelim medicine program at UCI that is available though. So some of our faculty at UC Irvine, we've got Dr. Han, who's our program director. Dr. Ye, she's one of our 2 associate program directors, and she is TBI board certified. Dr. Paray Karimi, she is pain certified. Dr. Corey and Dr. Majors, they do more of our outpatient clinic and some of our consults. At another facility, we do Long Beach Memorial, which is a private hospital we work at. Dr. Ko is one of our assistant clinical professors and the medical director there. And then Dr. Lee is our 2nd associate program director and spinal cord injury trained. Dr. Bedell is another professor there. Long Beach Memorial is associated with Miller Children's Hospital. So this is where we get our pediatric experience. Dr. Bedell is pediatric and spinal cord injury board certified. And then the VA, we spend quite a bit of time at the Long Beach VA. So we've got quite a bit of faculty there. Some of the highlights, Dr. Takamoto, he's kind of our clinic, musculoskeletal clinic guru, and he's kind of one of the main points of contact that you'll have. He does a lot of the teaching for us. Dr. Barrowood does some of the interventional pain procedures at the Long Beach VA. Dr. Tran does a majority of our EMG training. And then Dr. Han and Dr. Chen are part of the spinal cord injury unit there, so is Dr. Kansari. And then Dr. Soy is one of our newer professors who's, she does a lot of the musculoskeletal clinic at the VA as well. And then we're fortunate to have quite a few research faculty that are associated with our department. Some of the more notable ones who have more of an active role in our residency are Dr. Cummings, Dr. Hatch, and Dr. Sharp. It's really nice to have a lot of different research opportunities that they have. And they also will jump into didactics and help guide us along with journal clubs and things like that. So there's a lot of learning that goes on from our research faculty as well. So here's a picture for those of you who are not familiar with SoCal of where our sites are located, working our way from left to right. The furthest leftmost spot is our Long Beach Memorial location. A little bit to the right of that is the Long Beach VA. In the right side of the screen, kind of the upper right corner, that's where UC Irvine's main health campus is. That's where the main hospital is. And in the bottom right, that's Irvine. So that's the main undergraduate campus for UC Irvine. We don't spend too much time there, just about 6 weeks, and then some occasional didactics down there. I just mapped it out. You know, of course, SoCal is known for its traffic, but in rush hour today, the drive time from Long Beach Memorial to UC Irvine's hospital was about 30 minutes. So that's about as bad as it gets. It can be closer to 20 minutes on a good day, and even closer to get to the VA from there. So not too bad. As far as structure of our rotations, we have our rotations are broken down 5 a year. So each of them are 10 to 11 weeks. Over the course of the residency, you'll have 20 months of outpatient, 12 months of inpatient, 10 weeks of consults, and 4 weeks of elective time. And so, as I mentioned before, rotation sites are UCI's Medical Center, Long Beach VA, Long Beach Memorial, and Miller Children's Hospital, and then the Gottschalk Medical Plaza, which is at that UC Irvine's main campus in Irvine. So as a PGY2, these are the breakdown of the 5 different rotations. You do a general inpatient rotation at UCI. You do another general inpatient rotation with a focus on spinal cord injury at Long Beach Memorial. We'll do an MSK or outpatient rotation at the Long Beach VA, spinal cord injury outpatient rotation at the Long Beach VA. Then you have a research and outpatient clinic rotation at UC Irvine. A little bit more about the outpatient and research rotation that we've got. We have two different tracks as far as research goes. So if you want to just have more of a clinical focus, you can just do our track 1, which during this rotation allows you 1 day per week of research time. But if you want to take on a little bit of a larger project, try to get something like a large clinical study published, you can go for the track 2, which is our research focused track. And so this one allows you 2 to 3 days of research per week. And some other highlights, the badges project, something I'll highlight in the next slide here. And then on this rotation, we also do some a mix of clinics, especially in other services. So like MSK radiology, orthopedic surgery, we get some EMG experience, and then some general outpatient PM&R experience there. So the badges project was developed by UC Irvine in 2011, and it was recommended by the AAP to be used nationwide as an introduction to research by PM&R scientists. So it's basically a big self-directed curriculum, basically to help you feel more comfortable reading scientific literature and conducting research. So it's really nice to have, sometimes it can feel daunting to just be told, this is your research block, go do some research, but this gives us some structure and allows us to be guided in our approach towards performing research and getting things published, which is really, really helpful, especially when you're, brand new PGY2. As a PGY3, we do our pediatric inpatient rotation at Long Beach Memorial at that Miller Children's Hospital that I had mentioned. We have another rotation of general inpatient, primarily consults at UC Irvine. And then we have one block that's broken up into 2 different parts. We've got our pain rotation, which is 6 weeks long at that UC Irvine Gottschalk Closet down in Irvine. And then there's an additional 4 weeks of elective on that block as well. And then we've got our prosthetics and orthotics and EMG experience at the Long Beach VA. And the EMG experience, I got to say, it's one of our best rotations. It's really just 2.5 months of just doing EMGs every day, which, with EMGs, they can be kind of confusing, but when you really get immersed in the topic and you feel like you're really getting to understand it, really become an enjoyable experience, and really one of my favorite rotations that we had. As PGY4, we do more outpatient consults at UC Irvine, outpatient and consults. We do a inpatient rotation at Long Beach Memorial, which is focused on TBI and stroke. And then we do a interventional pain rotation at Long Beach VA, along with some musculoskeletal medicine. And then we do 2 rotations that are split 50-50 between musculoskeletal medicine and EMGs at the Long Beach VA. As far as our call schedule, as a PGY2, you'll take 10 weeks. It's home call. You cover our UC Irvine ARU, which is a 14-bed unit. Our call goes from Thursday to Thursday. You're answering pages from home from 5 p.m. to 7 a.m. And on weekends, you come in to round on the ARU patients, as well as to see any new consults that have been seen. The amount of calls that you get overnight, it's definitely variable. There's, plenty of nights where you don't get a single call at all and you sleep through the night, which is great. More often, I'd say you probably get, a few pages around, 7 or 8 p.m., right around shift change when the nurses are switching out. So some things that you can take care of before you go to bed. And then, occasionally you do get woken up overnight, but it's extremely rare for our residents to have to go in when you're on home call. I'd say it happens to maybe happens once a year. That's being probably generous. I really only know one person that's had to go in after hours. As a PGY3 and 4, it gets even better. You're only doing 5 weeks of home call per year. You're covering the Long Beach Memorial Rehab Unit. And so that covers both adults and peds. And so the census can be a little bit higher, around 15 to 20. Same thing though, same structure, answering pages 5 p.m. to 7 a.m. from Thursday to Thursday. And then you come in and round on patients and consults on the weekends. All right, as far as our didactics go, we do an educational half day. So Thursdays from 1 to 5 p.m. is our weekly didactic time. We're on an 18-month schedule, so you'll see every topic twice throughout your residency. Here are some pictures of things that we've done that have been, particularly memorable. We had a device company come in and show us this virtual reality injection device, which was kind of fun to train with. An ultrasound guided procedural didactic rotation or didactic experience. We were able to do some pool therapy one day. As far as our procedural experience, I'd say this is one of the stronger aspects of UC Irvine's residency. You get a wide array of different procedures, all closely supervised with a good amount of, they definitely give you quite a bit of supervision in the beginning. And once you feel more secure and comfortable, you definitely get a lot more freedom on these procedures. And we do these at the VA. We do them at the Gottschalk Plaza, where you'll get the majority of your pain experience. And we do some at UC Irvine's Medical Center as well. The procedures that we'll do, some of these, you really will have no trouble meeting your numbers for any of the different procedures. A lot of these things, we far exceed the numbers that are required by the ACGME. Peripheral joint, bursa, tendon sheath injections, you're going to get a ton of those. EMGs and nerve conduction studies. After just half of my overall EMG experience so far, I reached 75% of the overall numbers, and so I still have, I'll likely double that number by the time residency is finished. Same with the the epidural injections and the medial branch blocks, facets. Those I reached my numbers within probably the second week of our pain rotation. So definitely far exceeding those numbers as well. We do a lot of trigger point injections, Botox injections, pump refills, peripheral nerve stimulators, and genicular nerve blocks, radiofrequency ablation. We do quite a bit of prolotherapy at the VA, a lot of things like that. So a lot of procedures in this program. As far as the salary goes, recently our union negotiated some higher salaries for us. This improved quite a bit since when I started, which is really nice to see. So you see the numbers there: 66,000 is PGY2, 69,000 is PGY3, 71.8 as a PGY4, which is great. And then benefits. So we get 30 days maximum off per year per the ACGM or the AAPM&R requirements. So that's not really a UCI's rule. That's coming from the AAPM&R. 20 days of vacation per year, 12 days of sick days, 5 educational days for conferences. And so those actually do not come from the 30 days maximum off per year, and 5 interview days across the entire residency. So that doesn't necessarily need to be for fellowships. It can be for any job or really any sort of interview that you need. As far as additional funding, we get a housing stipend, which is really nice. You don't have to live within any certain distance from the hospital. Everybody has access to this. It's $8,000 a year. We get $1,500 of educational funds. So those that, that's something that can be used towards travel reimbursement or towards purchase of an electronic device or textbooks or really whatever, as long as you can justify it as an educational expense. And then $80 of meal allowance when you're at UCI. We'll reimburse your licensing fees, and you get 4 weeks of parental leave that does not count against your 30 days off per year, which is really nice. All right, where our graduates go, running a little bit short on time here, so probably not going to run through all these different things, but the answer is everywhere. We've got residents going into fellowship every year. Typically 1 or 2 people going into pain, sports every now, about once a year, spinal cord injuries, maybe every other year, somewhere around that. And then plenty of people going into academics, private practice, a lot of them staying in California, but a lot of them leaving California too. More recently, last year, we had one of our residents go to pain at UCLA, another one going into a sports program in Utah, one going into pediatric rehab at Harvard. And then, you can kind of see the rest. Somebody, Dr. Lynn stayed with us at UC Irvine for pain the year before. So really a good mix of people going all over the place, but definitely a little bit more on the pain and sports fellowships side of things here. Popular cities, there's a lot of things to do in SoCal, where people like to live, typically Huntington Beach, Long Beach, Irvine, Orange, Anaheim, Sunset Beach. I live in Seal Beach. It's really nice. I found some affordable apartment housing, which is 3 blocks from the beach. So that's really nice for somebody who's coming in from out of state. Really maximizing my beach time was definitely a priority, and it's really easy to do here. Other things that we can do, Disneyland's in Anaheim, so that's really close to the main hospital. We got Knott's Berry Farms and Universal Studios in SoCal as well. Here's a picture. You can rent some boats, go out on the Newport Harbor. On the right is Catalina Island. You can take a ferry from Long Beach, go out to Catalina Island and spend a day out there, maybe stay overnight. It's really nice out there. And we got a lot of professional sports teams. We get quite a bit. We get free tickets to the Angels and to the Anaheim Ducks. And there's other sports teams here in the SoCal area. We like to hang out outside of residency, try to be pretty active, do a retreat every year. Vegas is not too far, just 4 hours or so. We like to play basketball after didactics. Yeah, like to hang out, have fun. Thanks, everyone. Just if you have any questions, you can reach us at UC Irvine PM&R@gmail.com. Valerie and I will watch those. We'll watch that email account. So any questions that you don't get answered here, we're happy to answer from that email account. So now I'll open it up to questions. Thanks, everyone.
Awesome. You got about 5 minutes exactly.
All right, let's see what's been in the chat here. Let's see. Does anyone have any questions that haven't been asked so far? Let's see. Here, what's the culture at the program like at UCI? So I'd say, it's definitely a positive culture. I haven't met a toxic individual in our program yet, which is really nice. Everyone's really helpful, really like to teach. I'd say one of the strong points of the culture in our program is that at every different site, every different place that you go, you're always paired with residents of other classes. So there's a lot of teaching that goes on from the PGY 4s down to the PGY 2s, a lot of interclass interactions, which is really nice, which really helps promote a really strong residency program here. What else do we have here? Do you feel like
jump in as well,
yeah,
Nate?
sure.
Because I started answering them. So for the community outreach opportunities, in the last 2 years, obviously things have slowed down because of COVID. But prior to that, we used to, some of the residents used to be a part of like staffing, not staffing, I don't know what the right word is, but we would be at like marathons or runs and volunteer as like the medical staff there. So there's definitely opportunities. And I know there's another questions about sports coverage. So prior to COVID, we did have some residents who were able to go to like high school sports events and cover those. I'm not sure what the opportunities are now with that. And then our program has accepted IMGs in the past. Currently in our class, we have Purnamya Suri. She went to Ross, and could definitely reach out to her if you want to talk to her about it. 4 weeks of elective time, I think was enough to explore my interest. I'm going into spinal cord injury, so I actually just took that time to do research. I know Nate is going into pain, so he primarily did all of his elective time in that. And this coming year, our PGY3s are very interested. They're all interested in pain, so we tried to optimize their elective time and like all of their pain. I don't know how to explain what we did for them, but it was, we tried to give them as much experience as we could in pain and what they were interested in.
Yeah, to kind of piggybacking off of that, one thing that can be really tough for residency programs is getting people pain experience before the pain application opens up, because that opens up really early. It opens up in December of your PGY 3 year. So in a case where there's 4 out of 5 residents interested in pain, it could be pretty challenging. But this kind of jumps into one of the last questions that was asked here: how responsive is the program to resident staff concerns? The program worked with us to shift the schedules around so that basically chop some blocks in half so that everyone was able to get that pain experience, so that they could apply as a strong applicant towards pain, despite the challenges that pose for our scheduling and for the faculty that were happy to do it for us.
Yes. are there opportunities available for residents who want to utilize OMT? We actually have a lot of residents who come out of, is it Western, Nate?
Yeah.
And they're like the fellows that stay on an extra year to do OMT training. So there's no formal like opportunity, but I know that some residents have definitely made that a part of their practice already. And they actually, I'm not DO trained, but they have, you know, taught us, and like we do a lot of, they do a lot of education with their colleagues, but also doing them with patients as well. Lots of questions here. I'm trying to answer them all in 5 minutes.
You got about 20 seconds left. And if you both have the time, you're more than welcome to stay on and keep answering questions in the chat as well.
For sure.
Okay,
We'll
20
do
seconds
that.
isn't a lot of time. We'll just wrap up then. Thanks everyone for allowing us to do this and coming and listen to our talk. Best of luck to you all in the match. Good luck with the whole interview process. Can be daunting, but it's also a lot of fun. All right, hope to see you guys soon.
Bye.